This was quite good.
That is
Good.
good. It's the spot.
Yeah.
And go live.
I think we need to go live, and I realize people can hear us, but like play an intro while people are logging on. We need to
The whole
create
thing.
like an intro. You know what I mean? Like an intro, like Amy has
Mm,
that whole little skit video thing. That would be cool.
we'll do it.
Hello, everybody. I know you're joining on. I'm Dr. Rahi Victory, fertility specialist, double board certified Canada and the US. And I'm here with my amazing, amazing car enthusiast, best friend, Tarek Ibrahim from Ibrahim Strategies Group, who is here today to talk to us about all the questions you guys have. And I think we're just going to do questions because I didn't prep that article. So we'll just do questions tonight because people didn't get enough questions last time.
There was a demand for questions.
Yeah. Wow, Chels is already in with the question. Chels is like always.
Do you
ready to
agree?
go.
She's looking for confirmation.
Yeah. Yeah, that's wild. 10 days post-ovulation, faint lines. Stop testing at 10 days post-ovulation. That is way too early. I love you too. She says she loves me.
You're a
Strictly
lovable,
platonically, I don't want anyone to get the wrong idea.
you're a lovable individual. I love you.
I love you too. Yeah.
Yeah, 100%.
Again, strictly platonically.
Yeah, correct.
How's the sound? Is good? We're all good?
I'm double checking the sound right now.
Are we okay?
Speak.
I'm speaking. Is it working? Yeah, that's all good. No, I got that all going.
Bring it closer to you. I think you're too far. All right, talk.
Hello, hello.
No,
Not
move
much.
move the gain maybe.
The game? Which one of these guys is this guy? How's that? Better? Is that better?
More.
Better, 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 better. Worse, 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 worse. Better, better, better. Not happening so much. All right, we're working on sound, folks. I don't know, Charles. I do think it might go up. There's no way to know. Now it's working. Sounds okay. Good. Well, welcome to the show. This is Fertility Fact or Fiction. I am your host, Dr. Rahi Victory, and we answer your questions on all things fertility related. So we usually start off with some exciting announcements. We are waiting for someone to join us. Any notice from our friend who's supposed to join us? No? And she has the link. And she has the link. Okay. Well, we have a giveaway, but I'll see if she joins us. And those of you who are in and or around Toronto will have an opportunity to go to an exciting event this weekend.
Hello from Ryan and Sarah from Sarnia.
Oh, hello. Hi, guys. So I think that interesting today in the fertility world, I found out that there is a test now available from a Canadian company, which claims to be able to detect if you have endometriosis. It does not require an endometrial biopsy like Receptiva DX does, and they can tell from your blood if you have endo, regardless of what stage it's at. And they claim between 92 to 96% sensitivity and specificity. So we're going to try to, I might actually trial it in my patients to see kind of, if I think they have endo, and then take them to the OR and see if they do or they don't. But it's at least inspiring because if they do, it would be very cool to know that they do. And I mean, I've never been a believer in any of these blood tests that are available, but I know the guy that developed this, and he's a pretty bright guy. And he used to work at McMaster. He's gone into private care and private business now. And so now he's got this. So we're going to actually have him on the show in the near future to talk about the test. But it certainly would be cool if we had a test that we could use to detect endometriosis, because right now we don't have a good test for that.
Hi from Australia.
Yeah.
Can't wait to meet you. We have our appointment in July. Thumbs up.
Oh gosh, I'm sorry you have to wait till July, but that is only a month away now, so that's not as bad.
From Australia.
I feel so bad. That's the reason I work 24/7. People jump on and say they're waiting forever, and I feel bad.
Hi, Dr. CNT.
Yeah.
Is there benefit in using Zymo cold culture, Jerry incubator, calcium ions for?
Zymo, we're not sure. The company wants you to think yes, but we don't know for sure.
She's here.
Carly's here?
Aaron's here.
Oh, Aaron's here. Okay, great. So let me answer this real quick. So Zymo, we're not 100% sure. The company would like you to think yes. Several studies have said no. One has said yes. Co-culture, not really. We don't see very much benefit to that. Calcium ionophore oocyte activation, yes. Neupogen media, yes. Time-lapse incubators, maybe. So we're not 100% sure. For those of you watching on TikTok, I apologize. We cannot share Aaron in any way. But Aaron Fordham is here from Oasis Fertility Network. So we're going to have Aaron on the show. Aaron, thank you for joining us.
Hello.
And yeah, it's good to have you here. I know we had talked about getting you on to talk about this exciting giveaway. So why don't you tell everybody a little bit about yourself and what you do with the Oasis Fertility Network, and then what that does and what the event is.
Sure. Thanks so much for having me on. It's great to be here. I have tuned in quite a few times to this show, and I always get something great out of it, even if it's just a laugh and like a really good ha-ha, which is always good for the soul too. So my name's Erin from Oasis Fertility Support Network, and we provide in-person and virtual support groups all over Ontario. We currently have 8 locations in person. All of our support group programs are free. There will be 2 new locations, hopefully by the end of this month. But the closest one to you over in Sarnia is in Chatham, Ontario. I'll list them off. We have Chatham, we have Guelph, we have Toronto, we have Kingston, we have Barrie, we have Newmarket, we have Sudbury for all of our northern friends, and we have Aurelia. And coming soon, I can't say, so stay tuned. Follow us on Oasis FSN for more information and updates. And then we have a bunch of virtual groups. One for infertility, and then we'll support you right through pregnancy and into postpartum, so you can join the different stages of your journey with other people who are experiencing infertility as well. And then we also have a group for intended moms. We have a group for single moms by choice, which is just starting this month. You can sign up for any of our support groups at oasisfsn.com. And we can't wait to meet you and see you and visit with you and share and listen and vent and learn about all the things fertility with all the people who are going through it with you together. Find some community.
Venting is huge, so I love the fact that you said that. So what exactly do people like? How does that work for people that sign up for it? Is it a subscription? Are they paying? Is it free? Like, how does that work?
Yeah, great question. All of our programs are free. Oasis is a non-for-profit, and so soon to be charity. Just somebody who has a connection with the government, please help us. Yeah, we've reached out to a few MPs in the region, but we're going to get our charitable status so that we can just continue to provide free supports and programs. We also have a podcast, and it's called the Oasis Fertility Podcast. It's very, very unique, the name of it. We thought it would be easy to find. But basically, our podcast is just telling stories about people's fertility journey. And the reason, it was something that I couldn't find when I was going through my 10-year journey. And I just wanted to connect with somebody's story. I just wanted to hear a story and know, like, okay, I'm not alone. The whole purpose of the organization is so that you know you're not going through your fertility journey by yourself. There are other people that are going through this and in the suck with you. So just find those people so that you don't have to feel like, you're in the desert by yourself.
That's awesome. I actually do know someone that can help you with the charitable status.
Okay, good.
Yeah, why don't you contact me offline and then we can chat about that afterwards.
Amazing. Thank you.
That's awesome. Okay, so tell us about this amazing event that you have coming up. And we bought into it, so we contributed, but unfortunately no one from our end can go. So we are going to raffle off those tickets. So tell us a little bit about the event and what's going to happen and how many people can go and all that fun stuff.
Yeah, thank you. So yes, thank you so much for your support for the event. I actually just did a post on our Instagram for all of our clinic sponsors. So as one of our clinic sponsors, you get 2 tickets to the event. And because we unfortunately planned the event on the same weekend as the MSRI conference. There's a few
Yeah.
people that are going to be away, so we're not going to do that next year, trust me. But for this year, the event is taking place on Sunday afternoon, June 9th. It's actually our second annual fertility party. So we're having a high tea. It's going to be the full high tea experience that you would get if you went to the King Eddie, downtown Toronto. If you've never been to the King Eddie or the King Edward Hotel for high tea, it is like so fancy. It's all of the little delicacies. It's like amazing food. We're going to have a bar. We're going to have champagne so people can, you know, have a good time. There's going to be an amazing silent auction, a local musician who's been through fertility herself. She's got an amazing surrogacy story. She's going to be selling her books. So many great things. So a photo booth, you don't want to miss it. It's going to be great. And there's actually also a prize for the fanciest hat, so that everybody gets really dressed up for this event. It's going to be great. Think Bridgerton, think the Kentucky Derby, you know, it's going to be awesome.
Oh, wow.
Yeah.
That kind of hat, like the
Yes.
really big, that's interesting. All right.
It's going to be
cool.
fun.
All right. So we got to create a raffle. So are we going to have that happen through you, or do you want us to do that on our end?
Totally up to you. I mean, we obviously want to pick somebody who's available and can attend the event. So I don't know if you want to, like, yeah, however you guys want to do it. I'm here for it.
Why don't we see who watches tonight? And if any of you are watching tonight, why don't you message us? And if you want to go, what time is it?
It's going to be from 1 to 4 p.m. on Sunday. That's this Sunday, June 9th. And yeah, at the King Edward Hotel, so downtown Toronto.
Okay, you're putting a sign up thing on YouTube?
Maybe something like that.
Okay, Tara can put something on YouTube, so if you're watching on any other platform, also jump onto our YouTube, and he'll put something
I'll
there.
put thumbs up.
Yeah,
Everybody, yeah, I got it. So I want to say,
Perfect.
anyone that wants to attend this event on Sunday,
yeah,
put a thumbs up in your comment right now. Everybody puts a thumbs up.
okay.
I love
And
it.
then
You'll go through it.
we'll go through it and find out who wants to go.
All right, perfect.
Okay,
Sounds
I
good.
have something else though. Let me just finish with
Okay.
this. So
Chell says, just pick me up, I'll go.
I see that. She's ready to roll.
if you don't get the tickets from here, I have a very, very specific discount code for anybody listening right now that is exclusive
cool.
to this live for 10% off your ticket. We're only doing this right here, right now. The code is only good until 5 p.m. tomorrow, but the code is count me in. Okay, count me in. I'm not putting it in the comments. You got to be hearing this right now. Count me in for 10% off your tickets if you want to get there. If you don't win the live tomorrow, you have till 5 p.m. to use the discount code and get 10% off. So that's just exclusively for you, Dr. Victory. So thank you for having us on. Thank you for promoting this. This is a fundraiser, so there's going to be all kinds of fun things happening. So thanks again. And hopefully we'll see
Thanks for
you there
coming on. We
tomorrow.
appreciate what you're doing, and it's a great and noble effort that's, you know, helping a lot of people, and the fact that it's free is incredible. So we love that about it, and that's why we support it. So yeah, thank you for coming on. Absolutely awesome. We will have some people show up, and folks, if you want to go to the show, how much are the tickets normally without the discount?
Yeah, so 99 bucks for the full
Okay.
high tea experience. Yeah.
Perfect.
Which
so
it's
you can
pretty
go to
close
the
to there.
show and buy tickets, or you can get to the we're raffling off. So courtesy of VRC. So thank you again for joining us. Really appreciate you coming on. Thank you for watching the show. And again, huge thanks for all you're doing. It's amazing for all the people out there that need that support. And like you said, they need to vent. So I think that's awesome.
Our pleasure. And we're so happy to support the community. And just keep watching our page because we're going to have new locations popping up all the time. Amazing.
Thank you. Have a wonderful night.
Thank you, guys.
Okay, take care. Big thumbs up. Thank you. Erin Fordham, everyone. Wonderful group of women who run Oasis Fertility Support Network. Incredible people that came up with this plan and really have grown it to something amazing. And we're really proud to sponsor them and to promote this for them. So phenomenal. So if you want to go, let us know for sure. And Tarek wants a thumbs up on YouTube.
Thumbs up in the comment section. You have to make a comment of a thumbs up.
Make a comment in YouTube with a thumbs up.
Or Facebook or
Facebook or whatever.
or Instagram, no problem.
Okay. Lost 40 pounds, still 250, just found out I'm pregnant. Can I continue working on weight loss safely? Yes, you can. You absolutely can. Yep. All right.
Ready?
Yeah, I'm ready. You know, we always have a hot drink. This is
new.
This is good.
Yeah.
This is Middle Eastern. It's a yogurt drink. So
Yogurt drink.
yeah.
Absolutely.
I did call it the right thing, right?
Yeah,
Levan?
lemon, yeah. That's what they
Levan?
call it.
Yeah. Okay.
They don't make this in Egypt, by the way. It doesn't exist.
Really?
Yeah.
Okay, so in Iran we call this dul,
Oh, there you go.
and you can have it with sparkling water, so it's gassy,
Oh.
or you can have it flat like this.
Oh, I
But then they put herbs in it too,
Mm.
so it's like an herb. It's
They're
really,
cold herbal.
it's really good. I love it. Yeah, it's great with kebabs. So
Oh, Dr. BNT.
yeah,
SCIG
yeah.
has now become available at other clinics for fertility
Oh
patients.
God, here we go.
As we are excited enough to bring this back, especially for patients who have RPL. I'm your patient, high NK cells.
I'm working on it. We know what we need to do. I've already spoken to the people responsible for making it happen. I am presenting the case and I'm working on it. That's all I can tell you at this point. I think we'll probably get it, but right now I'm working on it. So I cannot get it yet. Someone very near and dear to me contacted me earlier today and told me that they had some news about it. So there may be a way to get it. But I already looked into the other clinics that are offering it, found out how they were offering it, and I'm gonna be doing the same, but I need to figure it out because it requires the head of a blood bank basically to approve it. It's not just as simple as saying, yeah, we're gonna do this. Like it needs approval. It's not something I can order by myself. Yeah.
Is day 6 euploid 5BA or day 6 euploid 5AB better? Thorofactoderm. Thorofactoderm. Yep. I'm pretty sure that's what it is. Or inner mass better?
Oh, trophectoderm.
TH.
I was like, what? Thorough what? Trophectoderm or what?
Inner cell mass better.
Yeah, that's a great question. So we know that between A's and B's, there's very little difference. So in an equivalent embryo, roughly like that, a day 5 will be better than a day 6. But there's probably very little difference between those two embryos. So you'd be fine either way. Which one would I take first? I'd probably take the day 5 first. I don't know if my embryologist is watching, my lab director, because she's ill right now, but Fariba, if you're watching, tell me which one you would choose. A day 5 5BA or a day 6 5AB. I think if I know her well enough, she would choose the day 5, but I could be mistaken.
I would choose the day 5 too.
You would choose it.
But I am not. Let me tell you this.
You are not an embryologist.
I am not an embryologist,
Yeah.
for sure.
No.
I have no.
Nor am I.
Yeah. Doctor, maybe. But embryologist, no way. That's where I draw the line. I Dr. VNT, 38 years old, DOR, AMH 8.4, day 3, FSH 14, AFC 13.
DOR, day 3, AMH 14 or FSH 14?
DOR, AMH 8.4.
Oh,
Day
8.4.
3, FSH
Yeah, 14.
14.
Okay.
AFC 13,
Okay.
all other day 3 results, it's normal range.
Yeah.
Research stims with FSH this high.
You could wait a month, but you'd probably benefit a lot from priming is what we would offer a patient like that. I can't tell you what to do, but in a situation like that, we would offer our patients priming. So we would talk about priming with testosterone, DHEA, human growth hormone, and you're not DOR if you have an AFC of 13 or an AMH of 8.4. So I'm not sure who told you you were DOR, but you're not DOR. Now, if your FSH is high, yeah, sure, you could wait a month to make sure it comes down. And the priming would probably help you do that. So that's probably what we would offer a patient like that, but you have to talk to your RE and see what they're thinking. But I don't understand how that's considered a DOR situation. Somebody needs to explain that to me.
Candace had a lovely comments.
Candace, yeah, what'd she say? Ah, yes, just aspiring Dr. T's choice.
Trust.
Just trust aspiring Dr. T's. Oh, look at that, Soraya's back. Joho-y Habibi.
Welcome back.
Hello, Soraya. Yeah.
Biggest question in the world these days. I sent you an email about
Oh, Ozempic babies.
it. Well, pig needs on Ozempic for fertility, not for weight loss to help, but the med itself.
Yeah. Ozempic doesn't work by helping your fertility, guys. That's why I haven't posted on it, because Tarek actually sent it to me the other day. He said, you got to post on this. I was like, Ozempic is silly. We already know, and I've said it on the show for 5 years running, that if you lose weight, you improve your fertility. And, you know, some people get angry about that because they feel that we're fat shaming. I am not fat shaming anybody. I'm simply saying scientific fact. If you are in a heavier BMI category and you lose weight, we know that it improves your fertility. Scientific fact, unquestionable, validated a million times over in so many studies I've lost track. And we've presented many of them. So what does Ozempic do? It makes you lose weight. So it's not a fertility drug, it's a weight loss drug. And because it makes you lose weight, you're going to improve your fertility, which is why people have Ozempic babies. So it's like, you know, everybody's like, oh, Ozempic. I mean, yeah, sure. I mean, if you lose weight, you're going to have a baby. We could call it a gym baby if you went to the gym. We could call it a keto baby if you did the keto diet. It doesn't matter what you do. As long as you lose the weight, you're still going to get the exact same benefit as Ozempic. There is no magic to Ozempic that makes you more fertile. It's the weight loss, plain and simple. The big difference, Ozempic is very potent at making people lose weight. So even people who are in like really high weight categories, body mass index categories, are able to bring their weight down considerably. And because of that, they do well. It's okay to message me. I know who that is.
Okay.
Okay.
Hi, my favorite doc. Singular.
Singular, yeah, you're totally wrecked.
Yeah. I have endo
Yeah.
and blocked fallopian tubes, and my endo doctor told me to excise it. But do you recommend lap or stimulation and retrieval first?
So if you're removing your fallopian tubes, they need to be removed before transfer, not before retrieval. Depending on which technique they use to remove the fallopian tubes, you can actually reduce your ovarian reserve if they burn too much close to the ovary, which can compromise the blood supply to the ovary. So it would depend on what technique they use. When I operate, I mostly use the harmonic scalpel. It has 1 millimeter of lateral thermal spread, so I can stay tight on the tube and not worry about heat damage going to the ovary. But if you're using something like the ligature, which has 5 to 7 millimeters of lateral spread, and it itself is very wide too, you're going to do a lot of damage. So it depends on what technique they're using and how they're doing it.
Soraya's
On fire?
she believes you're drinking her goat milk
I
right
see
now.
that. I drink my goat milk.
She's all in. And Carly's got a question for you as well.
Carly, big, huge congratulations from everyone in the community to Carly. Yay. Yeah, baby. Yeah, very cute. Very, very cute. Oh, and Andrea's on. Hi, Andrea. Okay, go ahead. Now that Andrea's on, she's our geneticist.
No,
So now when we have a genetics question, I'm just going to make her come on.
There you go.
Answer, yeah.
yeah. Hi, Dr. V and Dr. T.
Yeah. There you go. Now you're happy.
Respect,
Yeah.
absolutely. Do you like to use growth hormones in DOR, and what dose and when do you use it in the protocol?
We do. We use 2.5 per day, and we start 2 weeks before the stim and continue it till the stim is done. somebody has asked like 10 times, can HCG help with male fertility? Yes. If the male has low FSH/LH, you can stimulate the testicles with HCG. It can be helpful.
Andrea says, uh-oh, bye.
Oh, no.
She's gonna stay.
That ain't happening. Yeah.
Hi, Dr. V. Is spontaneous conception always preferable to using your frozen embryos? I'm 35 and have embryos from 32. Any reason to think my younger embryos would be healthier than not conception, than natural conception?
No. I mean, embryos from IVF are generally just as healthy as natural. There is a 1 to 2% increase in the risk of fetal anomalies if they've done ICSI, but that takes it from a baseline risk of 2 to 3% to an overall risk of 3 to 5%. So it's not like a huge difference, guys. So yeah, I mean, it's basically the same. We don't distinguish between natural and IVF. Now, are there other risks from IVF pregnancies? I mean, it depends on what protocol they use and how they get you pregnant. So if you're on a hormone replacement therapy protocol, yeah, you have higher risk of high blood pressure, preeclampsia, preterm labor, IUGR. If it's a fresh embryo transfer, higher risks of complications. If it's a frozen embryo transfer, most of those risks are mitigated depending on which protocol you use. So for example, with letrozole, we see very low rates of preeclampsia.
Lost 40 pounds.
I answered that one.
Oh, you did that
The
one?
one that's 250.
The one that's 250?
Yeah, she can lose weight during pregnancy. Yeah. So if you lost weight before, congratulations, that's awesome. And if you're pregnant and you want to continue losing weight, you can actually lose weight in pregnancy. If you're 250 pounds and it's inappropriate for your height, then you can lose weight during pregnancy safely, but don't lose too much. Like it's not the right time to be trying to train for a marathon. So it's reasonable to lose some weight, but probably maximum of 10 or 15 pounds. Keep in mind that even if you just hover with your weight, so if you stayed at 250, because your baby is growing and your blood volume is increasing and the uterine mass and the placental mass and the amniotic fluid are increasing, you're actually losing weight even if you stay at the same weight because your baby is growing. So if the baby's going to be 8 or 9 pounds and you're 250, you're actually only 242. And then there's the amniotic fluid, another pound or two. And then there's the placenta, maybe half a pound. So all of these add up to maybe 10 to 15 pounds total. And so you'd actually really be 235 once you deliver the baby. So you don't want to lose too much because you're already losing even if you just hover. So keep that in mind as you go through it.
Is Ozempic safe for males during IVF? And will HCG help with male fertility?
So as I said, HCG does. Ozempic, we don't know. Everybody's trying to jump on Ozempic. We don't know. And there are people that have had massive problems from Ozempic. There's that whole Ozempic face with the wrinkling and the kind of scarred look. And then there's paralytic ileus, which is where your bowel stops moving and they actually have to cut you open stem to stern to get your bowel to rejuvenate. That's not good. So if you ever want to mess up your fertility, have bowel surgery. Yeah.
Hi, Dr. B. Is spontaneous conception always preferable to
No, you asked.
I did that?
Yeah.
Good day, Dr. B and Dr. T. Yes, indeed.
This show has become your ego trip, man.
I come Monday, I'm almost in the gutters, contemplating suicide.
Suicide.
Tuesday shows up on top of the world.
You're on top of the world. Dr. T is
Yeah.
back. Yeah.
I go home,
And then
no
it's
one can
like
talk to me.
And then it's like
It's a steady
grind.
decline. Reality hits in. Yeah. That's what it is. Why is it that doctors refuse? I don't know. Let's see. Why is it that doctors refuse to do an IUI on women over 40, even if their partner may be a little younger? Number 2.
What?
How is it that someone can have a low AMH and still have a decent?
A decent.
Yeah, that's what you got. You got to work with that. a decent AFC. Some studies are now saying
Yeah.
that they aren't always directly
No, they're
related.
not always
What are
directly.
your thoughts and thanks?
Yeah, they're not always directly correlated. So we know lots of women where the AMH is off compared to their AFC. And it may be the test, it may be the way they tested, it may be what you were on when they tested. So it's not a one-to-one correlation by any means. With regards to why would a doctor refuse to do an IUI? I'm not even aware that a doctor is allowed to refuse to do an IUI. So, yeah, no one would be refusing to do an IUI. That sounds absurd.
I'll be honest, I would never refuse. I'd put the options out, make sure everyone's aware of the situation, but refusal is not how I roll.
Soraya, I can't even say it. Soraya says, I haven't found a man yet, but if I find one, then I can talk about having a baby next time.
That'd be great.
on the show.
We would help her so much.
Fertility after dark. That's
That's
it.
it. That's what it needs.
Yeah.
Problem is after dark's becoming later and later. You know what I mean? Like, you may have to push the show back a little bit. Have like that good half an hour after dark special. Because it usually works out. The first 30 minutes is really
You know, a couple of times on this show, we have verged on pornographic.
no, sir.
Yeah.
No, it's all in the name of medicine.
Yeah.
It's science. You know, it's exactly science because you know you can go and see the female anatomy, for lack of better words, on YouTube. No problem when it comes to medical stuff.
Oh yeah, that's true. Yeah, you can. Yeah.
Everything's available.
Everything's available.
But at the same time, there's other moments when you can't see anything.
When you can't, yeah, that's true.
So this is all for the sake of science.
All for science, yeah.
Yes, this is all science.
Although we have had some.
No, just science. It's always science.
Yeah,
The children are watching. It's all science.
my daughter's probably watching.
Oh yeah, she commented on just a little bit ago.
Oh, did
Saying
she?
she's at a presentation talking about her poster.
Oh, good.
Yeah.
Go baby, do well, make daddy proud.
There you go. I'm curious. She's gonna swim from the chandelier.
I see that,
These
yeah.
are references for a
Candace
great
asked,
show.
yeah, Candace asked if the babies get bigger. Yeah, they do by about 10%. She had a gigantic baby last time. 10'9".
Oh wow.
Lucas.
10-9.
Lucas was
10 pounds?
10 pounds, 9
Big
ounces.
baby.
I just delivered a baby 9 pounds, 13 ounces before I showed up.
Oh really? That's what you were delivering? Wow.
Yeah,
9 pounds.
very big meatball.
Huge baby.
Huge baby.
Yeah.
Yeah.
My twins when they were born were 2 pounds,
Oh my God.
1 ounce, and 1 pound, 9 ounces.
Wow. Tiny. Like,
They're complete opposite of that spectrum.
palm.
They were in palms.
Yeah.
Yeah. They were like little gerbils, for lack of better words. I'm the dad. I can say what it is. You know what I mean? I was afraid to touch them. I'll be honest. I'm like,
Were you?
oh yeah. I'm like, no way. I remember when the kids were in the incubator, and the nurse was like, oh, you want to change their diaper? I'm like, no. She's like, oh, but it's nice to bond with your kids. I can't touch this. This is so small. What if I break something? Oh, they're resilient, she says. I had a heart attack. Every movement. Was
Did you do the diaper change?
I let my wife do it. I'm like, you showed me how to do it. Someone do it before I break it. You know what I mean? I want to make sure, like.
How long before you changed the diaper?
Well, we were in the hospital for like months. You know,
Yeah.
they were preemie. So eventually, I did it during the time of the hospital. But I for sure didn't jump at it. I
And
was
how
like,
many weeks were they when they were born?
32.
But they were tiny 32s. Yeah,
Yeah, it
really.
was twins.
Yeah,
Yeah, or maybe 28.
yeah, it had to be early.
Maybe 28.
Yeah,
28. Does that sound early?
Yeah.
Maybe even 26. They were like 3 months early.
well, 3 months would be 28.
28. It's about that. 28.
Wow. See, guys, Tarek has personal experience. He's got skin
yeah.
in the game.
You want to talk about going through,
All of this.
all of this?
Yeah.
I got a lot of stories on this from a different perspective, of course.
Of course.
Of course, you know, different perspective.
All right.
Yeah, continuing on. Hi,
Yeah.
I'm curious. If you're open to doing lit therapy to someone who is a patient at another clinic in a different city,
Yes.
if I want to remain at my clinic for the rest of my IVF.
Yeah, I got no problems with doing lead for anybody that wants lead. because it's not going to interfere with anything anybody else is doing for you. And we would give you instructions on what to do. Yeah, no problem.
No problem.
Give us a shout.
I was gonna say I'll do it. You know, no big deal.
You'll do it?
I'll do
Yeah.
it, yeah.
I got to teach you how first.
Yeah, I've never seen that part yet.
No.
RPL,
Yeah,
38 years old.
okay.
Will you let me transfer 2 embryos, 1 PGT, 1 untested? History
Yes.
of endo, adeno, and RPL.
Yes, that's totally reasonable. Yeah. Would you?
Well, at the end of the day, we can only offer advice. You know, if the patient, that's what they're insisting on,
I would do too. One tested, one untested. You don't know what the untested.
throw the dice and see.
Yeah.
I'm with it.
RPL, endo, adeno, like there's a lot going on there.
Yeah.
Yeah.
RPL for sure. You gotta do it. Everybody wants the best results. Here we go.
Yeah,
This question's for you.
yeah.
Is cramping 3 weeks post endometrial biopsy normal? No
No.
other symptoms, but worried I could have caused endometritis. Endometritis,
No, it would not.
as previously had this and was treated after fertiliosis. Should I redo a fertiliosis?
Well, I can't tell you if you should redo a fertility, but cramping after an endometrial biopsy 3 months later is definitely not normal.
Did I miss the research you were going to talk about with IVF you mentioned?
No, so there's a great article I wanted to share with everybody about whether or not you should change your protocol, but we didn't get to do it last time because we had guests on the show. And we didn't get to do it this time because I was doing a cesarean section before I came here. We didn't have time to prep. So is anyone on the show with us next week?
You might. This was meant to be a break show because there was supposed to be someone, but I don't know if we confirmed it just yet. There's
For
one
next
other,
week?
yeah, there's one other person that was supposed to technically get that spot if you weren't busy. From what
I'm
I
not
recall.
busy next week.
Yeah, so we might have
Maybe.
somebody.
Okay,
We might have somebody.
okay. Well, we'll figure it out.
Yeah, we
Yeah.
might have somebody.
Okay.
Good morning, Dr. V and T.
Yeah.
From the Philippines.
Oh, I don't think we've had a Philippines.
This is brand new.
Amazing. Hello. Good morning.
May I ask,
Of course.
when is letrozole co-administered in IVF egg stimulation? I did round 1, 375, FSH, 75, LH, and 1 blast of 7 mature of 11 eggs, R2 letro, 2.5 days, 2.5, day 1, 4, 300 FSH, and 75 LH, 9 embryos.
I totally lost what all that was.
There's
So
a lot
let
of
me answer the question. Yeah.
short hands.
So thank you for watching all the way from the Philippines. That's wonderful. We love hearing about where people are watching from. That's amazing. So letrozole during IVF stim can be started on day 3 of the stim. Some people would just do it for the 5 days if you're trying to boost the response of the stim. Some people will do it the whole time if they're trying to suppress the estrogen levels, or if it's in a breast cancer patient where you don't want the estrogen levels getting very high. The dilemma you run into is that you have to go longer because the letrozole tends to make the follicles more immature. And so we don't love it. We started doing it and then I stopped because we just weren't getting good results from it. So we stopped doing it. But it is doable. I just don't believe in it anymore because I tried it and I was like, yeah, that's not good. There's a whole debate about pelvic health here. Is 16.1 bad FSH for a transfer? Your FSH is meaningless for your transfer because you just need to get your lining ready. So it doesn't matter. As long as your lining responds, you're okay.
My baby was always measuring in the 50th percentile, but she came out SGA. Could it have been IUGR?
Well, somebody must have been measuring you wrong or incorrectly if you were measuring in the 50th percentile, but the baby came out small for gestational age. So I need to know more details about that.
That was Carly.
Oh, that's unusual. I'd have to see what they said. I'd have to look at your ultrasounds again, Car, and then have to see what the weight of the baby was. So that's very unusual. Doesn't make a lot of sense. Yeah, I will. How's the baby?
I had a miscarriage and my period came back, but light and only for a day and a half. Is that common?
It can be. I mean, some people have very heavy periods, some people have very light periods. So it varies from, case to case, patient to patient. So typically the periods are heavier. If it was persistently lighter, I would just want to make sure you didn't develop any scarring after your DNC. Yeah.
I have boy-girl twins.
Okay.
People ask if they are identical, but a doctor on TikTok said it's possible. How could that be? See, doctor on TikTok giving terrible advice. I would never give that advice. I would actually say impossible to have boy-girl twins identical. They're obviously boy-girl. Identical's already out the window. My humble opinion, but I'm not a doctor.
That's not possible.
I knew it.
They can't be identical if they're not identical, first of all, by definition.
By definition.
The only way that would, Dr. T's expertise, ladies and gents,
There it is.
the only way that could happen is if you had two boys and one of them had androgen insensitivity syndrome, which would make him look like a girl.
Oh,
So it's not
look
a
like,
true
but it's
girl.
not a true girl.
Yeah.
I got
it's a-
that. I know what you're saying.
It's a 46XY, but with androgen insensitivity, so they develop looking like a female.
Yeah.
But they don't have a uterus.
Yeah.
Yeah, that doesn't make sense. Don't listen.
Maybe I should message that doctor on TikTok
Yeah, I
and
wanna
take his
know
degree
who
back.
I want to know who that doctor on TikTok was. Yeah, yeah,
We should confiscate his degree.
yeah,
I'll take it and put it on my wall.
yeah.
All right. To the.
Oh, wait, Carly, she was 5 pounds, 11 ounces at 39 plus 2, but was in the 49th percentile at my growth scan at your office. Carly, I gotta go back and look at that. I mean, scans are never totally accurate, so keep that in mind. They can be off by up to, at that stage of the pregnancy, by off as much as like 2 to 3 weeks worth. So it is possible if you're a tougher scan, it can make it, or the baby's in a weird position, it can make it a lot harder to scan the baby right. So I'll review it for sure with the team, but there can be babies that are smaller, but are measuring okay on the ultrasound. The error increases as you go through the gestation. So in the first trimester, it's usually like 5 days to 7 days. In the second trimester, it's 2 weeks. And the third, it can be up to 3 weeks. So your baby could actually be born much smaller than it was measured.
Salud, Dr. Victory.
Salute.
Desde la isla de Cuba.
Oh, Cuba. Wow. Okay. Good Spanish accent.
Not bad, eh?
Yeah. that was
The
pretty-
accent I threw in, the actual reading probably butchered,
Yeah.
but it sounded legit.
Yeah.
Hi, Dr. B. I'm currently 4.5 weeks pregnant.
Okay.
My biggest concern is my TSH. My blood test showed it was 3.75. Is that considered high? If so, should I be put on a thyroid medication? My family doctor refused.
Oh, well, I would get your T4 checked to make sure your T4 is in range, but we do like your TSH less than 2.5. So you should adjust it if your T4 is low. 35 years old, can I just opt to pay for NIPT in Ontario? Yes, you can pay for NIPT in Ontario. We do actually have a two-tiered healthcare system. It's just nobody is willing to.
It's hush hush.
Yeah, no one's willing to admit it. Yeah.
Can you use essential oil roller ball for sleep that contains lavender, chamomile, and valerian roots? The website says don't use if pregnant. They also make a peppermint roller ball for headaches.
What the heck's a rollerball?
This is something
I
that I've
don't know.
never run into.
Is that like something you throw in the bath?
I can Google it real quick.
I got no idea what that is. So
Roller ball. It's a movie. I guess that's not it. I guess that's not it.
no, that's definitely not it. Oh, Andrea. Oh, here you go, Andrea. Also, there could be 2 twin boys and one loses the Y chromosome and is therefore a female. So that would be like a Turner syndrome that became a Turner's because it was supposed to be male. I guess. I never thought of that, but yeah.
Yeah, but that's still not a.
Okay, we got it. Oh, she's saying, but far-fetched. Yeah.
Yeah, but
Okay.
for sure.
Yeah, but you can't have identical twins with one being male and one being female unless there's a chromosome missing or a gene missing that changes the genetics. Yeah.
We should have just left the tank in the first place. Like, why are we even getting in there?
Yeah, I know.
You know?
Yeah.
So this rollerball thing, I just got a bunch of pens showing up at this point. So I don't know what it is. Even when I Google it.
Well,
Release muscle pain?
I have no idea.
Anyways, that question, we
No.
don't know. If they say not to use it during pregnancy, my bet is not to use
Don't
it.
use it during pregnancy. Yeah.
That's my deep
Yeah.
insight.
Yeah.
Hi, Dr. V.
Yeah.
Access for fibroid treatments is apparently available at Humber River Hospital now with Dr. Del Roche.
Accessa?
Accessa,
Yeah.
yes.
Yeah.
Is this something you can refer to your patients?
I think it's a stupid thing to do. It doesn't make any sense. Accessa is this device that you stick into the fibroid, because I was one of the original research locations for it, but then they didn't go through with it. And it has this spindle thing that comes out of it, goes through the fibroid, and you basically electrocute the fibroid to kill it. So it shrinks at 50% by volume. Okay, so what? Like, you still got a big fibroid there. It's not going to be that much smaller. It's like taking Lupron or Orlissa or Myfembry. It's going to make the volume smaller, but you still got a fibroid uterus. Why not just have surgery and get them removed? So if you're already going in for surgery, which you need to for Accessa, why wouldn't you just get them removed? And there's a newer device coming from the UK that can be done without, they claim, without any anesthetic, which does the exact same thing. It can be done in the office transvaginally. So you don't even need laparoscopy to do it. Accessa is like a pain in the butt to do. So yeah, I'm not really into that. Sage essential oils most likely. Yeah, I don't know. Mina's asking the same question over and over again. Can we answer that one?
Let's go.
How to prepare for FET? Struggling to choose protocol. M36 secondary infertility normal cycle. Letrozole. It's the best protocol, so you don't need to struggle. Double progesterone, vaginal and injectable, because that's been proven to be best. Lots of supplements: melatonin, coenzyme Q10, vitamin D, iron, your fish oils, and your prenatal. And make sure they're checking your progesterone levels. And that should be everything you need for the basics, unless there's more to it. But that's a basic protocol that we would use for anybody.
The doctor couldn't explain. Just said, trust me, for the twin non-identical identicals. Trust me, he says.
Andrea and I will do a video together, although I'll probably have to drag her on kicking and screaming, on that doctor. Somebody send us the link for that doctor, and I will happily shred that one. Those are the most fun ones where we can tear someone apart because they said something idiotic. So I need to know about that one.
Hi, Dr. V, Mr. T.
Oh, wait.
Go ahead.
I got to tell them about the news from today. So a colleague of mine from another clinic, who, of course, for professional reasons, shall remain nameless, contacted me today because this individual had asked for my assistance with a patient that needed Fertility testing. And I offered them the assistance and explained what to do. And they just told me today that their patient is pregnant. So I thought that was awesome and super cool, and another notch for Fertility. So it was cool to be able to help someone totally unrelated to us, because, you know, one of my colleagues who I really love and would dearly love if that individual would abandon the place that they're working with and come and join us, wanted help, and I offered that help. So good for you for asking, and congrats to the patient. That's awesome. Yeah, it takes a lot to kind of swallow your pride and reach out.
You know what? I'm beginning to see that's what it is.
Does. I mean, I have no trouble. Like, I'm willing to reach out to people. I unhesitatingly will ask someone, but I think when you get to that level and you're busy and you've got a reputation, it's like people sometimes feel like, you know, they shouldn't ask. I'm the opposite. I'm like,
Mhm.
I just want to make it better for people. So I'll ask anything I need to ask. But it takes a little bit of grit to
Grit. Yeah.
to swallow your pride and reach out to someone.
Absolutely.
Yeah.
And you only learn from that.
You do, because
Only learn from
we get better when we work together as physicians. The fertility industry as a whole is very sadly antagonistic, not in a like, I hate you, don't talk to me way, or I'm not giving you away my secrets, but people don't like make an effort. I was talking to one patient the other day who went to a clinic in Toronto where they did 3 rounds of IVF for $120,000
Wow.
for 3 rounds of IVF. So when I pointed out that that was over double what we would charge, like we're like 35% of that, right? This patient said that they had gone to another clinic, and in that clinic, the physician had said, well, I don't trust the embryos that they made you, so you would need to do another cycle with me before they could help you out. And she had embryos already, good, like PGT tested, good quality embryos. So I mean, there's that like antagonism between the centers that shouldn't be there. Like, we should all be here to help you guys. So if you come to me and you want me to help you with someone else, like, we offer that service. I'll piggyback onto somebody else's cycle and help. I need your doctor to be aware, because I don't want you to get medications from 2 of us and it conflicts. But like, we should be collaborating to help people. But unfortunately, it's a business and people don't like doing that. So I'm always willing, but in any event, for my colleague, I'm very proud of you. You did the right thing, and congrats on the win. Yeah. Where am I located? We're in Windsor, Ontario, right across the border from Detroit, but now we're also in Sarnia, St. Catharines, and Woodstock, Ontario, and soon the UK.
You're going there.
We're going there. Next week, I'll find out.
Oh, wow. That's great.
Yeah.
I have my fertility consultation tomorrow,
Okay.
and I don't know
Fertility.
fertility.
Oh, fertility. I thought you said fertility. Okay.
Fertility
Yeah.
consultation tomorrow.
Yeah.
I don't know what to ask for the consultation. IVF is not an option. ATM. Is there anything that I could request? I have PCOS.
Oh, well, if you just have PCOS, you don't need IVF. So first thing you want to know is, did they do a thorough history? Did they check your partner? And then what are they going to talk to you about and teach you about? Because it is about us educating you. And then you need to know what your options are. So if they tell you you need IVF because you have PCOS, I would turn around and run, because that's total nonsense. You're the first person I tell you that IVF is your last option. You don't need IVF. So find out what they can do to help you. Find out what all your options are. If it's just PCOS, depending on whether you're in a high weight category or low weight category, your options would be metformin, letrozole, weight loss, multiple supplements, NAC, inositol, coenzyme Q10, resveratrol, ALA, plus all the other basics that we talk about all the time. And then lifestyle changes if weight's an issue, diet, weight loss, those kinds of things. So between all of those, it's usually actually pretty reasonable to get pregnant. It doesn't work for everybody. Sometimes you need to go up to insemination. And yes, there are some women that still need IVF, but I've almost never recommended to someone with PCO that they start with IVF if that's their only problem. So see what they tell you they are going to do to test you, find out what they tell you they think is wrong, and then find out how much education they're providing you and find out what your options are. Yes, you can take metformin in pregnancy, Saralyn, to control PCOS, not diabetic. It's fine. Metformin in pregnancy probably reduces diabetes, so it's a good thing.
Can I adopt a frozen embryo at the age of 48?
Yeah, why not? We're not ageist. We don't discriminate based on age. Well, I shouldn't say that. We stopped doing embryo transfers after 55 now because of our ethics committee. But aside from that, we don't restrict on age. And that's higher than anybody, I think.
Fertility suggests our NK cells are through the roof.
Oh boy.
We have since treated with 2 rounds of lit. Afterwards, you told us to go home and have lots of sex.
Yeah.
With a history of RPL, what are our chances of conceiving naturally and carrying to term? 27 years old, all previously tested embryos are euploid.
High, I would think. I mean, if the lit worked and you probably would need some steroids, we might recommend intralipids. But if your NK cells came down from just the lit, which often happens, then yeah, you should be fine. You got a reasonable chance.
I've been struggling to get pregnant for almost 40 years now. Thank you for such good information.
Oh, my pleasure. You know what? The most satisfying part of this show for me, aside from seeing Tarek every Tuesday, because that's hugely gratifying, but aside from the joy of seeing my good buddy here, it's when we hear, I think for me, and I'm curious about what you say, but for me, the 2 biggest joys are, one, when we find out where people are watching, the Philippines, Cuba,
That's nice.
we're having an impact worldwide, which is super cool because we're providing information for free. So I can go home and feel good about what we do here. And the second thing is when people send me messages saying, you weren't even my doctor, but we listened to you. And I post them every once in a while. And we were successful because of what you said on the show. And I think like that's so cool. So cool. Yeah. Hello, if I'm still spotting on day 10 and using Gona left, do my follicles still grow? Your lining and your uterus have nothing, and your ovaries have nothing to do with one another necessarily. Yeah, sorry, I was saying Holland.
Holland, of course. How did we forget? We never forget.
We never forget. You can't forget,
So
sir.
you can ask the question one more time for the tickets on sale.
Oh yeah, if you're new to the show tonight, we are raffling off tickets for high tea at the King Edward, was that what it was called? Hotel in Toronto, a fancy hotel with a full high tea with Oasis Fertility Support Network on Sunday between 1 and 4 o'clock. It's very fancy and elegant. These tickets are free because we contributed and none of our team can go, so you can go in our stead. You will have to be on your best behavior because you will be representing VRC, so please don't get hammered. And
Fancy dresses.
yeah, fancy dresses. And there's a hat contest. You got to wear those Kentucky Derby big poofy hats. The wilder, the wackier, the better.
Yeah, that's basically right. So if you would like to get it, put in the comment section a thumbs up, and we'll review it and we'll DM you if you want. But you need to put it in the comment section. I don't want like a thumb up emoji on the live.
Because we'll miss it.
Because we'll miss it. You have to physically comment,
Yeah.
thumbs up, or write it down, thumbs up if you're on the platform for whatever reason you don't know how to do it.
All right. Almost 9.
Yeah, I give them time to thumb it. Okay,
Good night, Soraya. She's leaving.
just go see my man. Thank you. What is your opinion on a woman delivering in different positions besides on their back?
So there's some evidence to support the idea that women that are crouching have an easier labor, like the labor bar thing that midwives like to use. There is actually evidence to support that. Here's the, absolutely brutally honest answer for it all. I have zero control when you're in some wacky position. We get people that want to deliver on all fours and people that want to deliver, in a crouch position where I can't control what happens. And if your baby gets stuck, and they do get stuck sometimes, the shoulders get stuck, and I need to get that baby out, I got minutes. Like if I got to wait for you to turn over and flip over, like God knows what's happening, right? So we much prefer you be on your back. Now, thankfully, 80% of women get an epidural, which is great for pain control. And if you have an epidural, you have to be on your back. But or at least knee chest, but you can't really deliver knee chest with an epidural. But if you don't have an epidural and you're laboring naturally and you don't care about the tear and you're willing to lie back quickly or, lie down on your back quickly. I mean, I believe women should have their choice. Do I like it? No. Is it terrifying for me as your physician because I got to worry about the stuck shoulder? Yes. But am I going to let you have your autonomy? Of course I am. It's your baby. It's your pregnancy. You got to go do what you got to do.
I had missed this question here. Good evening, Dr. V, and the one and only Mr. T.
Mr. T, there you go.
I'm wondering if lead therapy could cause a flare-up of a known autoimmune condition.
Not that I've read about or been aware of. So not that I'm aware of, no.
Thoughts on embryo group for a transfer?
Should be done automatically, and I personally feel it should be free. No one should be charging for it. It's not expensive. So we charged for it initially until I calculated what it cost, and then we stopped charging for it because for what it costs, no one should be charging for it. So we just put it in for free. Everybody gets embryo glue when they come to us, and the data is very clear that it's beneficial.
Dr. V, when would you recommend a mini stim? What's a typical low dose protocol, and how many eggs can you get? Thanks very much.
So I recommend mini stim when you either have religious reasons why you don't want a lot of eggs, or if your eggs seem sensitive to the meds because you did a full stim and you didn't do well. Otherwise, I actually don't recommend it because it doesn't make a lot of sense. In those situations, you want to use 150 units a day. We would use Menopur. You can use whatever you want, and it does tend to work fairly well. Yeah.
I just had a retrieval on Friday, 30 eggs retrieved, 30 mature. Woo!
That's huge.
There's still more. It's just I didn't want to.
I know.
Like the TikTokers.
It's the TikTokers.
Yeah.
Yeah.
30 eggs retrieved, 30 mature, 24 fertilized, and 22 on day 3. As an average,
Wow.
What could I possibly see on day 5?
Minimum, you should see 11, but you could see more. I mean, sometimes you'll see less, but it sounds like you've got very good results, so it could be excellent.
Can you take a probiotic while taking prednisone?
Yeah, of course. Why not?
Who benefits from SCIG? What does it treat?
Lots of different immunological conditions, high NK cells, DQ alpha mismatches, low T regulatory cells. I mean, there's a bunch of different things you can use it for. So recurrent pregnancy loss, recurrent implantation failures. There's loads of different circumstances in which it works well. High NK cytotoxicity, low LADs.
903.
Done. Okay, we are going to sign off because we got a busy night, and I think I still have to call somebody tonight. I wish you all a wonderful evening. Thank you for watching. We'll see how next week goes. If it's not a person on the show, we will talk about whether or not you should change your protocol. If it is a person on the show, we'll have to postpone that. I do want to say that July 9th, which is a Tuesday, is a Baha'i holiday, so we will not be having the show.
July 9.
Yeah. So we'll have to figure out an alternative for that night, but I cannot do it that night. Have a great night, everybody. Lots of love, and we'll see you next week on Fertility Factor 50.